Good morning, sir.
Good morning.
My name is Sonia. I'm gonna be your nurse, and I'm gonna do a head to toe assessment today in anticipation for your new job. Okay?
Okay.
And can you state your name for me?
Jeff Goldsworthy,
And what is your age?
47,
What is how tall are you?
5'10",
Okay. And what is your weight?
210 pounds.
Okay. So as I mentioned before, I will be performing a head to toe assessment. And do I have your permission to do this today?
Yes.
Okay, thank you. Okay, I'm going to start taking your vital signs. So I'm going to take your blood pressure. I will take your radial pulse, and at the same time, I will be taking your respirations. Is that okay?
Yes.
Give me your hand, please. I'm going to check on your radial pulse. And I'm going to count to 30 seconds and multiply that by 2. Okay, good. Let me check your blood pressure, please. Do you have any problems with your pressure? Your blood
No.
pressure? No. Okay. Healthy?
Yes.
Just relax your arm. Here we go. Thank you. Yeah, it's pretty good. It's 175 over, sorry, 125 over 75. So I'm gonna check on your respirations, and I'm gonna count also to 30. Just give me your hand. 30 seconds. Just relax your arm. Thank you. Okay. So your radial pulse is 64, your respirations is 18, and your blood pressure is 125 over 75. Are you having any pain today?
No.
No pain. Thank you. Okay. So patient is alert-oriented to person, place, and time, and he is well developed. He has an upright posture with position and present no deformities at all. His mobility is unlimited. His facial expression is appropriate to situation. His appropriate mood and affect. Speech is clear, no difficulty hearing, right? Okay. And it's appropriate and clean hygiene. Okay. So now I'm gonna go over your skin, and I'm gonna start with your hands and nails. I'm gonna check in for color. Give me your hand, please. Moistures. I'm gonna check for any clogging of your nails. Capillary refill is less than 2 seconds, and the skin is appropriate to ethnicity, and no discoloration of the skin. Do you have any lesions on your skin or any rash?
No.
Okay. Skin is consistent with ethnicity background. Temperature is warm, dry. Skin texture is smooth, firm, and skin turgor. Let me see your skin, please, again. Is normal with no tinting. Okay, so I'm gonna move to your face, and I'm going to check for a face and head. Gonna palpate your scalp and looking for any wounds or deformities. So any issue with your scalp or any issue with your head?
No.
No? Okay. Let me check. So I don't see any wounds, any rash. Hair distribution is okay, even though, you know, okay, do you always shave your hair?
Mm-hmm.
Okay, good, you look good. Head is normal cephalic. So now I'm gonna look to your cranial nerve number 7. And then I'm gonna ask you, please smile for me. Perfect. Frown. And show me your teeth. And puff off your cheeks with air and blow. Blow. Perfect. Okay. So cranial nerve is symmetric. All his facial movements are symmetric with no involuntary movements and no weakness. I'm gonna move to your eyes, and I'm gonna first check, ask you, do you have any problems with your eyes?
No.
Any discharge, recent discharge, or irritation?
No.
Okay. So I'm gonna check for any ptosis, any lack, crusting of the eyes, or any symmetry, that your eyes are symmetric in any discharge of your eyes, okay? Open for me. Close your eyes. Okay, they are symmetric. Eyebrows are symmetric as well, and I don't see any lack of your eyes, so that's good. So patient has even hair distribution with no lid lack, no crusting eyes, and eyebrows are symmetric. So now I'm gonna see the color of your sclera. I'm gonna look for jaundice or any redness, lesions of your sclera. Open your eyes for me. Look at the way. Look at this way. Okay. Sclera is white, no redness, and no evident lesions. I'm gonna check for your pupil size and look for light reflex and convergence. And I will be using my pen light to do this. Just look straight. One more time. Left eye is 4 millimeters at rest, 4 millimeters constricted, and the same is with the right eye, 4 millimeters at rest and 3 millimeters constricted. So pupils are equal, round, and reactive to light. And now I'm going to check for accommodating of your eyes. So please look at the pane as it gets close. Perfect. And both arcs are accommodating. So next I'm gonna check for, that's for to check for your cranial nerve number 2, and that is to check for confrontation. So now please, every time I move my pen, you will see, so that's good to check for confrontation of your eyes. So move, right? No. Perfect, and cranial nerve 2 is intact, followed by confrontation with no abnormalities. Okay, so now I'm gonna check extraocular muscles to assess cranial nerves 3, 4, and 6. So please follow my finger through all visual panes, okay? Once again. Perfect. And all extraocular muscles are intact with no extradermal and no nixtamals. So I'm gonna check now your corneal reflex, and I'm gonna just shoot light to your eyes and make sure that the light is present in both eyes in the same spot. So just look straight. Perfect. And corneal reflex is symmetric. Now I'm gonna go to check to your ears, and I'm gonna looking for any lesions, any tenderness, drainage. And do you have any problems with your ears?
No.
Any discharge?
No.
Do you use hearing aids?
No.
Okay, I don't see any lesions. And both your ears are symmetric I'm gonna move to your nose and gonna check for sternal structure. Make sure that there is no discharge, no redness, and there is symmetry on your nose. Have you had any recent bleeding on your nose?
No.
No discharge? Okay. Check. Okay, so nose is symmetric, midline, your face. And I'm going to check on your nostrils, so I'm gonna cover one at a time, and then you're gonna sniff. Please sniff. Next one. Okay, and nostrils both are patent. I'm gonna move to your mouth and throat. Please, I'm gonna ask you to open your mouth and stick your tongue out, and I'm going to check for your lips, your buccal mucosa, and see if they are pink, if it's any lesions. Any problem with your mouth?
No.
Open your mouth, please. Okay. Please open and think and say ah.
Ah.
And now I'm gonna check for your gag reflex. Thank you. Okay, so gums are pink, no swollen, no bleeding, and tongue is moist. I check for cranial nerve 9 and 10 using my spoon as a tongue depressor, and he has a gag reflex that is intact. His uvula is a midline and is rise when he say ah. So it's okay with all the assessment of his mouth. So now I'm gonna move assess to your neck, and I will palpate your neck to check for your carotid pulses. Okay, perfect. And the carotid pulses are palpable bilaterally, and the trachea is at midline. I'm gonna check for a range of motions of your neck and muscle of sternocleidomastoid. So please do chin to chest and head back, and now ear to shoulders, other side. And then I'm going to perform the same movements just to check for cranial nerve number 11, and that's gonna be against resistance. So head to chin to chest. Okay, head back. This side, the other side. Perfect. And moving to the chest, I'm going to check on your posterior chest. Could you please sit down my head?
Sit?
Yes, sit right there. There we go. All right. And so I'm gonna check for a chest shape configuration of the posterior chest, the cage ribs, and I'm going to palpate to look for any pain or tenderness. So as I told you, tell me if you feel any pain. No pain?
No.
No tenderness?
No.
Okay. Patient has no barrel chest and no use of accessory muscles when breathing. So I'm going to check for tactile fremitus. So as I touch your chest, you just say 99. Say 99?
99.
One more time.
99.
One more time.
99.
Perfect. Tactile fremitus is equal in all areas of posterior chest with no lumps and no tenderness. Now I'm gonna check for your for CVA or tenderness of your kidneys. You just let me know if you feel any pain, okay? No pain?
Nope.
No tenderness?
Nope.
Okay, good. So next I'm gonna check to your posterior breath sounds, and then you will take deep breath sounds as soon as I move my stethoscope, okay? Deep breath. One more time. One more time. Okay. Okay, perfect. So normal kind of crackles and no wheezes on the posterior chest, and I hear vesicular breaths in all fields. Please back to your edge over here, and I'm gonna check for anterior breath sounds. Check on your lungs on the anterior side, and I'm going to pump it looking for any lumps or tenderness. No tenderness? No pain?
No.
Okay, and see, I'm gonna check for tactile firmness. Say 99.
99,
One more time.
99,
Perfect. And tactile firmness is intact is equal in all lobe fields on the anterior chest. Next, I'm going to check for your anterior breath sounds, and I'm gonna listen for wheezes, rhonchi, or any diminished breath. Take deep breath. Okay, perfect. There's no rhonchis, no diminished breaths on the anterior chest, and all the breaths are vesicular sounds in all fields. Now I'm going to check on your apical pulse, and this is located on the fifth intercostal space at the clavicular line on the left side of your chest. So this is gonna be right here. Okay, and your apical pulse is palpable, and then I'm going to listen apical pulse for 1 full minute. Perfect, and your apical pulse is 92. Is a rhythm regular, and I see hair sounds S1 and S2 are present with no murmurs. Next, I'm gonna check your range of motions of upper extremities. So I'm going to ask you to bring your arms up for me. Okay, and hands down. There we go. Side to side. There we go. And spread your fingers. Yeah. Range of motion is full and strong and equally bilateral. Now I'm going to do it against resistance. Up, down, side to side. Perfect. Okay. So now I'm going to check on your pulses, and let me see your radial pulses. And the brachial pulses. Perfect. And radial and brachial pulses are too close and normal. I'm going to move, lay down and check presence of JVB. Could you please lay down on the couch? There you go. Straight, there we go. And let me move this for you, please. Look at all that side. And look at this side. Perfect. And there is no JVD. And next I'm going to check on your abdomen. I'm gonna inspect for distension, looking for any pulsation of your stomach or your abdomen, I'm sorry. And just you go. Okay, no problems with your abdomen at all?
No.
And I see there is no, the abdomen is not distended, the umbilicus is at midline and inverted, and there is no pulsation of his abdomen. Now I'm going to move to check on your bowel sounds. And I will be checking for present hyperactive or hypoactive bowel sounds. Alright, and the bowel sounds are normal active in all 4 quadrants. Now I'm gonna move to do palpation on your abdomen. I will do a light palpation, just looking for masses or any bulging of your abdomen. And then I will do a deep palpation, and you will tell me if it's any tenderness or pain. Okay? No pain?
No.
And now I'm gonna go to deep palpation. No pain?
No.
No pain? No tenderness?
No.
Okay. So there's no masses, no tenderness, abdomen is soft with light and a deep palpation in all 4 quadrants. So now I'm gonna percuse to check for any tympani. Perfect. And this tympani is on all 4 quadrants are normal. Next, I'm going to assess on your lower extremities, looking for any discoloration of your skin, any skin lesions, any hair distribution, and any rashes of any injuries of your legs or your lower extremities. And any problems with your legs at all?
No.
Okay. Any recent injuries?
No.
Okay. Let me go check. Okay. No injuries. Skin is warm to touch, no rashes. Lower extremities are symmetrical with no pretibial edema, and no evident lesions. Hair is evenly distributed bilaterally, and the temperature is warm to touch. Now I will assess your toes, looking for any clumping or discoloration of your nails. Okay, no clothing of the toes, and capillary refill is less than 2 seconds bilaterally. Okay, so next I'm going to check on your pulses. I'm going to check on your femoral, popliteal pulse, and posterior tibial and dorsalis pedalis pulses. I'm going to start with your femoral, so I'm going to check here. The femoral pulse is 2+ normal. The popliteal 2+ and normal. The pretibial plus and normal, and the dorsalis pedalis 2+ and normal. So all pulses are 2+ and normal. So now I'm going to check on range of motions of your hips. Any pain on your hips? Any problem with your hips?
No.
Okay. So I'm going to palpate for any pain, tenderness, or any crepitation on your hips. No pain? Perfect. No pain, no tenderness, or crepitation of the hips. Okay. I'm going to ask you to extend your right leg up, way up. Now 45 degrees and down. And then 45 and down. Repeat it with the left leg. There we go. Thank you. And I'm gonna check for internal and external rotation. So please bend your knee. One of them. Right one. Inside and out. Inside. Now, there we go. And I'll do that with the other one. Okay. So range of motions is full with no problems of hips. I'm going to check ankles and feet, looking for any swelling, pain, tenderness, any ulcer or visible lesions. Any problem at all with your feet?
No.
Okay, so I can see it's a scar on your feet. This is due to what happened here?
Burn.
Okay, so he just had all burn, and that was for a motorcycle accident. Okay. It's healed. I don't see any signs of infections on any open skin. Okay, no edema, no ulcers of the feet. Skin is intact. Sensation is present in all areas, and then I'm going to check on your spine. So please stand for me right here, please. And I'm going to ask you to lean back and forward. Forward. There we go. And side to side. And turn to your side. Right. There you go. Okay. There is a full range of motions of the spine with no pain or tenderness. So what I'm gonna do now is I'm going to ask you just walk from across the room from side to side, just normal. The other side. Thank you. Now back on your tiptoes. Okay, and back on your heels. Thank you. So I'm gonna move this now. I'm gonna ask you just to sit right there. I'm gonna check for your reflexes. Okay, sit down. And I'm going to use my little hammer for this. And gonna check for tendon reflexes with your biceps. Just relax. There you go. Relax. Okay. And I'm gonna check on your triceps. Okay. Okay, next one. And I'm going to check with your brachioradialis. And next one. Okay. And your patellar. Don't exaggerate. There you go. Okay. And your Achilles. Perfect. So all his tendon reflexes are intact. Now what I'm gonna use is I'm going to check for a sensation using a Q-tip. So you're gonna close your eyes, and I'm gonna touch part of your body, and you will tell me if it's soft or if it's sharp. Okay? Close your eyes.
Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp.
Perfect. Sensation is present in all areas, and I'm going to check for, see what I forgot. Okay. I think that's okay. Alright. So what I'm gonna ask you is just sit down for me again. Okay. So when was the last time that you went to a dentist?
3 months ago.
Okay, you go how often to the dentist?
Every 6 months.
Okay. And do you brush your teeth how many times a day?
Twice a day.
And you floss?
Once a day.
Okay. And do you go regularly to your doctor?
Yes.
Do you go annually for your
Yes.
for your annual checkup? Okay. Okay. So this assessment is completed today. Do you have any questions for me?
No.
Okay. And if you have any other problems or anything arise by the moment that before you go to your employee, before we send this report, you can call your primary physician or you can reach to your primary doctor. Okay? Thank you so much, sir.
Thank you.